We hear constantly these days about new tech. New tech for our health, our phones, communications, new apps. It's hard to keep up, let alone knowing what out there actually works. Who's wasted money on things that have great marketing but don't actually work? Me. Hi, my name is Stephanie, practicing dental hygienist and ergonomic specialist, and welcome to my channel. Today, I'd like to focus on new tech and great products for dental clinicians that can help us be more efficient and more ergonomic while we're practicing dentistry. First, AI, artificial intelligence. It seems like everything has an AI aspect to it now. I've dabbled in it just a little bit, and it's pretty cool. The way I've personally used AI in the dental operatory is using voice-activated periodontal charting. Solo periodontal charting or solo charting of any kind when you're trying to input your patient's information into the computer has always been inefficient and an ergonomic nightmare. Some of us have assistants that can help put these findings into the computer. Being able to call out the numbers into a microphone that's attached to you that automatically puts these numbers into the computer is quicker, it doesn't lead to all the ergonomic no-nos, and it's not pulling team members away from other important tasks. Plus, this software charts everything: pocket depths, bleeding, furcation, mobility, recession, attachment loss. And the AI in this tech learns how you chart, learns your cadence, and only gets quicker and better over time. These voice-activated systems have really improved over time and do not pick up the background noise, which has been an issue with ones in the past. There are also software programs that will analyze the radiographs that you take. The AI in these programs can sometimes see things that we can't see with the human eye. It can pick up on problems like incipient decay, bone loss, root infections much sooner than what we can see with the naked eye. It's pretty cool because it marks up the x-rays with different colors, which makes it very easy for the patient to understand. Another new development is ergonomic loupes. I hate to break it to you, but not all loupes are ergonomic. I'll say it again, not all loupes are ergonomic. I've tried several different types of loupes over my career, and while they have provided really good, clear magnification, I've always had an issue with having to tip my head forward. For me, for a loupe to be truly ergonomic, it has to support you in neutral posture. If you aren't sure what neutral posture is, please refer to my previous video on neutral posture for dental workers. We need to have a loupe that will allow us to see while also keeping our head completely upright. So think of looking through a microscope. You're sitting upright, nice and tall, and you're looking through the scopes. Because of the design inside the scope itself, you're able to see down onto the slide without tipping your head forward. But these newer ergonomic loupes mimic that microscope posture. Sometimes these are called ergo loupes, prismatic loupes, or deflection loupes. Another great product is a saddle stool. Now, these aren't new, but they're still not the norm, and I think they should be. Saddles allow you to sit really high in an elevated position where your hips are well above your knees. This is a much more natural and healthy sitting position than what most of us do, which is sit on a traditional dental stool with our thighs parallel to the floor. That promotes a 90-degree angle in between our thighs and our torso. Sitting this way causes hip tightness, back issues, and it's really hard to get close to the patient chair. We want to have an open hip angle when sitting. Many traditional dental stools and office chairs, for that matter, do not promote this position, which is going to lead to issues later on. There are so many different types of saddles, different seat designs, with or without backrest, different heights. They are not one size fits all, and just like a pair of pants, you want to make sure that you find one that fits. Head over to my Instagram and look at my saddle stool highlight where I go over the brands that I love and also stats to give your rep. Do not be tempted to buy a $99 saddle stool from Amazon. Every now and then these work for a clinician, but for most people, they do not hold up over time and they don't provide that almost custom fit for you. Two other pieces of equipment that make a huge difference for us are handpieces. I'm talking about a cordless polisher handpiece and an electric handpiece. I have used a cordless polisher for the past year or so, and I will never go back. Never. You don't realize how heavy that cord is or how hard it pulls on you until it's not there anymore. There are many different ones available these days. Some allow you to use any kind of prophy angle, some don't. Some enable you to use the foot pedal, or you can use a button on the handpiece, which is great for standing. Now, for electric handpieces. Again, these are not brand new, but they're not as widely used as I think they should be. They used to be heavier and clunkier, but nowadays they're designed to be smaller and lighter and much much more ergonomic. They're more lightweight and balanced across your hand, which leads to less hand and arm strain. They also have a very consistent speed, so they don't stall or slow down when they come into contact with the tooth like the air-driven ones. You can almost mill the tooth in one pass instead of doing the repetitive motion of feathering like with the air-driven ones. Electric handpieces are also much quieter, which leads to less hearing loss for us in dentistry, and it's less intimidating for the patient. I like how small the electric ones are now, which allow for really easy access in the posterior. While the air-driven handpieces are cheaper up front, think of the long-term benefits of investing a bit more now with an electric one. There are so many other products that we could talk about. I wanted to share about the ones that I believe in most and the ones that I think have the highest ergonomic impact for dental workers. Ergonomics is a blend of being aware and mindful of our habits and using really good products and equipment to support us. If you like this video, please hit the subscribe button and stay tuned for more ergonomic tips to help you practice smarter, not harder.